Welcome to the EM Supply Room series, where we teach you everything you need to know to be in and out the supply room for your procedure in 5 minutes or less. An NYU EM APP Fellowship production. These are the materials you will need to place a chest tube. You will need the chest tube itself, 3 Kelly clamps, a scalpel, suturing material and the suturing clamp, 4x4s, scissors, and tape. You will also need a Pleur-evac, which comes in the Oasis or Ocean brand. Assemble the Pleur-evac before getting started, as this is not sterile. You will need sterile saline, which sometimes comes in the Pleur-evac itself, or you'll have to grab sterile saline from the supply closet. The saline is poured into a valve behind the Pleur-evac, located at the site of the red arrow. Next, set up your suction. Use the suction tubing on the Pleur-evac and connect it to a suction container, denoted by the yellow arrows. Then connect the suction container to the wall suction device. Adjust the suction on the wall as needed until a small, steady stream of bubble is produced in the water column. Do not use the tubing denoted by the green arrow, as this will be connected to the chest tube after it is placed. Position the patient supine. Have the arm on the affected side elevated superiorly above the patient's head. Identify the insertion site, which is usually the 4th or 5th intercostal space in the mid to anterior to axillary line, just lateral to the nipple in males or the inframammary fold in women. If your patient is pregnant, move superiorly up 1 intercostal space. Another landmark for insertion is superior to the ribs, as the neurovascular bundle lies inferiorly. Prep the skin with povidone iodine or chlorhexidine solution. Prior to beginning your setup, administer systemic analgesics like morphine or ketamine. Next, put on your sterile garb, including your cap, mask, sterile gloves, a sterile gown, and after this, place a fenestrated drape over the affected area. Prep the skin with chlorhexidine again. Infiltrate the skin with 1% lidocaine. Start by creating a skin wheel at the incision site and then advance the needle while aspirating. Insert the needle down to the rib and along the proposed insertion path of the chest tube or pigtail to create an anesthetic tract. Check for the presence of fluid or air in the syringe, indicating that you are in the pleural cavity. Now that your patient has been anesthetized and you're sterile, prepare your chest tube. And by doing this, you grab 1 Kelly clamp and place it at the end of the chest tube, and take 1 Kelly clamp and insert it into the very first hole at the beginning of the chest tube, making sure that the Kelly clamp isn't extending past the chest tube to cause any type of lung damage once you insert it. Make a 2 to 3 centimeter transverse incision through the skin and the subcutaneous tissue overlying the intercostal space. Extend the incision by blunt dissection with a Kelly clamp. Insert your index finger over the Kelly clamp to verify that you're in the pleural space. Then replace the Kelly clamp with your index finger. Next, sweep your finger in a 360 motion to verify you're in the right anatomical landmark and that the chest tube is ready to be placed. With your index finger still in the insertion site, grab the chest tube and the Kelly clamp. Use your index finger to guide the chest tube into the pleural space. Make sure to insert the chest tube above your finger with the clamp hugging the incision to avoid personal injury. Remove the clamp and continue to insert the tube, making sure that the last hole of the tube is inside the chest wall and advancing as far as needed to accomplish therapeutic effect. Attach the tube to the previously assembled suction drain system. This will confirm if the chest tube is in the correct location, as you will see pleural fluid draining or bubbles forming at the water seal level at the Pleur-evac. Take note that bubbles should be varying with respiration. Next, suture the chest tube in place by using a simple interrupted suture above the chest tube and then using the D-sign method to wrap around the chest tube and make sure that it is securely in place. Once the chest tube is secure, place Xeroform over the incision site. Cut a 4x4 as demonstrated here, allowing for the sterile gauze to be placed around the entirety of the chest tube at the point of insertion. Then tape the area to further secure the chest tube and the dressing. Lastly, get a portable chest x-ray to confirm all of your hard work.